Hello everyone, this is Dr. Sandeep Madaan, your anatomy faculty. So today we are going to have one quiz, and the topic of today's quiz is lower limb chapter. So for each question you will be given 45 seconds to solve, and that will be followed by the video solution. Okay, and in this part I have also added my like a Telegram group link as well as the Instagram link. Right now let us start with the question number one. So the answer to this question is B. Now, what structure is lying in the midway between AS, IS and pubic symphysis is the femoral artery. Let me zoom in this picture to show you. This is the sartorius muscle, and this diagram is for the femoral triangle. In the femoral triangle, we can see the femoral vein is the medial structure. Then we have the femoral artery, and further lateral we have the femoral nerve, right? So the this is B is the femoral artery. That is the answer to this question, right? And even medial to the femoral vein, we have the one part of femoral sheath that is called as femoral canal, right? And so far as femoral nerve is concerned, it is not a content of femoral sheath. So I hope you mark this answer. Now let us move on to the next question. Now, dear friends, answer to this question is C, femoral vein. Why? Because this is a case of femoral hernia, and the femoral hernia takes place when there is abnormal protrusion of any content via the femoral canal. Why? Because in the femoral canal we have only one content, that is the lymph node of Cloquet. Where is the femoral canal? It is the medial aspect. Let me just zoom in to show you. This is the femoral sheath, and the medial part is called as femoral canal. The medial compartment is called as femoral canal, where we have the lymph node of Cloquet, or the other name is lymph node of Rosenmuller. That is the content. So otherwise this is kind of an empty space or the potential space the hernia can take place, although femoral hernia itself is very rare. But if at all you compare the chances between male and female, it is relatively more likely to happen in case of female. But as I said, it is overall a rare type of hernia. So irrespective of sex, whether male or female, if they ask most common type of hernia, that will be inguinal hernia. Now let us take another question. Now, answer to this question will be C, the posterior rim of the acetabulum along with the femoral head, because it is the posterior fracture dislocation. So the posterior aspect of the acetabulum will be broken along with the femoral head. So that is a most appropriate answer over here, right? Now let us move on to the next question. So here the answer is straightforward, lateral cutaneous nerve of thigh. So we have these two conditions. One is chiralgia, which is because of superficial branch of the radial nerve, and this is myalgia, which is because of the lateral cutaneous nerve of thigh. Now, why this happens in case of involvement of the lateral cutaneous nerve of thigh? See, this is the nerve which is present at the superior angle of the femoral triangle. Because of any reason, if this nerve gets compressed, it will lead to the nerve compression feature in the outer aspect of the thigh, and those are the features of myalgia paresthetica. Now this nerve belongs to what? It belongs to a lumbar plexus. So let us quickly look at the nerves of the lumbar plexus. What are the branches? So here we can see these structures. This is the iliacus muscle, this is iliacus muscle, and here you can see the sacrum vertebra. These are the lumbar vertebra. By the side of lumbar vertebra, this muscle is the psoas major. This is psoas major, which gets pierced by the genitofemoral nerve. Right? We have this nerve over here. This is iliohypogastric. Iliohypogastric. And this nerve over here is ilioinguinal. Now, like, you must be thinking how to memorize these names. See, we'll use the mnemonics here. So we have the mnemonic: Ilias gets late, okay, on Friday lunch. Okay, the Ilias means, like, we have iliohypogastric and ilioinguinal. This is the genitofemoral nerve. This genitofemoral nerve is the one which is going to pierce through the muscle. So when you have cut the muscle, this nerve also got cut. So here you can see the cut part, and this late is the lateral cutaneous nerve of thigh, that is the nerve of myalgia. Okay, this is nothing but the nerve for myalgia, like which we have already seen in the question. And this is the obturator nerve. On is the obturator nerve, F is the femoral nerve. You can see this nerve is the femoral nerve, which is entering the femoral triangle, the anterior aspect of the thigh. The medial aspect of the thigh, over here we have the obturator nerve. So these are the branches, right? Let us move on to the next question, dear friends. Now, so answer to this question is obturator internus tendon, B choice. Now why so? Because you see, we have, this is piriformis muscle, and this particular foramen is the superior we have the greater sciatic foramen and the lesser sciatic foramen. So this for particular foramen will be the greater sciatic foramen, right? Even where we have the piriformis muscle, above the piriformis we have certain structures. Below the piriformis also we have certain structures, but all those structures are passing from the greater sciatic foramen. Right here we can see this is the sciatic nerve, that is also the content of the greater sciatic foramen. But then these structures like pudendal nerve, internal pudendal vessel, and there is third structure, that is nerve to obturator internus. These three structures are such that they are coming out of the greater sciatic foramen and then entering into the lesser sciatic foramen. That means they are part of both the sciatic foramen, right? So among these, definitely superior gluteal nerve will be passing even above, even superior to the piriformis muscle, and these two structures will be also passing through, but the obturator internus tendon only passes through the lesser sciatic. So now let us move on to the next question. So what's the answer? Answer is superior medial quadrant of the buttock. Why? Because now let us look at this sign. The patient is taking the right foot off of the ground and the right hip is dropping. Now to prevent the right hip from dropping, this was the duty of left sided muscles. So first question here is which buttock he has taken the injection. Answer will be left side. Now left side which quadrant? See, normally we should give in the superior lateral compartment, but by mistake he got in this quadrant, that is the supromedial quadrant. So his superior gluteal nerve got injured, leading to the palsy of gluteus medius and minimus muscle. That is, the sign name is Trendelenburg sign, right? Now let us take another question. Anji, what is the answer? Answer is B, superior gluteal nerve. Why? Because this marked muscle is gluteus medius. How? Let me explain. Let me zoom in and show you. This muscle is the gluteus maximus, which has been cut from here so that we can see the structures under cover of the gluteus maximus. Now after that we have the gluteus medius. This muscle and this muscle is the gluteus medius. In fact, it has been cut from here. After cutting, it has been reflected like this. So after this gluteus medius, deep to this part, this muscle which we can see over here is the gluteus minimus muscle. But these fibers, they belong to the piriformis muscle, right? So if this is piriformis muscle, above the piriformis, the superior gluteal nerve and vessels, which are going for the gluteus medius, going for the gluteus minimus, these are the superior gluteal nerve and vessels. And below the piriformis, this will be the inferior gluteal nerve, which will be approaching the gluteus maximus muscle. So now we know the gluteus medius has been marked, so answer will be superior gluteal nerve. Let us take the next question. So there was a little bit glitch in this part. Muscle name is already highlighted. So anyway, let us discuss this part. So gluteus maximus is the answer over here. So dear friends, let us look at the language of the question. The question says that the patient extends the thigh and laterally rotate, then there is like finding it, like she finds it weak movement. That means we are looking at a muscle which is involved in the external rotation or lateral rotation as well as extension of the thigh. So basically among these, what actions these muscles have? Obturator internus can do the lateral rotation. It is short lateral rotator muscle, but so far as extension of the thigh, it won't be able to do it. But tensor fascia lata and along with gluteus medius and minimus, it is a powerful abductor and medial rotator, but it is not involved in the extension again. Semitendinosus, it can do the extension of the thigh, okay, because it is a part of the hamstring muscle. They are involved in the hip extension and knee flexion, okay. But the thing is gluteus maximus, when you look at the gluteus maximus muscle, this gluteus maximus is the chief extensor of the thigh, and chief, along with the chief extensor, as per the fiber, it can do abduction as well as external rotation or lateral rotation. So that is why among these options, gluteus maximus can be used for these actions, right? Now, dear friends, let us move on to the next question. Now, what will be the answer here? Popliteal artery. See, when this a bony fragment will be coming and there will be laceration, any structure can be injured, okay? But because of the deepest position, answer will be popliteal artery. Let me discuss this. We can see towards the bone, we have the popliteal artery, and superficial to the artery, we have the vein, and then further superficial, we have the nerve. In fact, here we have the sciatic nerve getting divided into two branches. One branch will continue posteriorly, that will be the tibial nerve, and the other branch, which will be approaching the lateral aspect, it will be winding around the neck of the fibula. This is common fibular nerve. Common fibular nerve or common peroneal nerve, because the word fibular can be replaced with the word peroneal anywhere, okay. So that is about this part, and now let us move on to the next question. Now this one is a little tricky question and very like easy also in a way, because you see what is given is the clot given at the level of popliteal artery in the proximal end. Okay, but look at the choices: posterior tibial, peroneal, and anterior tibial. They are the branches of the popliteal artery. If the popliteal artery itself is getting blocked, its branches will not get any supply. So obviously by ruling out also you can reach the answer. Lateral circumflex femoral and the medial circumflex femoral, they are the branches of profunda femoris, which is a branch of femoral artery. So this can, among these options, this can be the only possible artery which will allow the blood by making the anastomosis around the knee joint. Okay, let me discuss this. We have the popliteal artery. This popliteal artery, this is the popliteal artery which will be giving these tibial arteries, right? You can see the popliteal artery coming from above. AT is the anterior tibial artery, PT is the posterior tibial artery, and posterior tibial artery itself will be giving the peroneal artery. Okay, so these arteries will not be having any blood supply if the blockade is there in the proximal part of popliteal artery. Okay, now let us move on to the next question. Now, what will be the answer? Here, the answer will be short saphenous vein. Why? Because we are looking at a vessel which gets terminated into the popliteal vein. Okay, so great saphenous vein will terminate into the femoral vein, whereas short saphenous vein will terminate into the popliteal vein. Let me just let me give you a summary of these two veins. This is important area. The questions are asked in our exam. Okay, so here we have the dorsal venous arch. When it joins with the medial marginal vein, it becomes it is the beginning of great saphenous vein over here. In the lateral aspect, lateral marginal vein, it will make the short saphenous vein. So great saphenous vein begins on the medial aspect of the foot, whereas the short saphenous vein in the lateral aspect. Now what will happen to them? Let us compare. The medially this vein will begin and then it will pass anterior to the medial malleolus. What is the course of the great saphenous vein? That will be the medial leg. It will be behind knee. We can see that it is behind knee, and then again it is in the medial thigh. Where it is terminating? It is terminating here in the femoral vein. But during its course, it is accompanied by which nerve? That is saphenous nerve. This question is also asked that if you are operating on the great saphenous vein, which nerve is at risk? That is saphenous nerve is at risk. But if you flip, you see the short saphenous vein. Now short saphenous vein, it starts at the lateral aspect of the foot. It passes behind the lateral malleolus. Now one very important point, even though it started in the lateral aspect of the foot, it does not run in the lateral leg. It does not run in the lateral leg, rather it runs in the posterior leg, reaching the popliteal fossa, where it will terminate into the popliteal vein. And it is accompanied by this nerve, that is sural nerve, right? So that is about the great saphenous and the short saphenous vein. Now let us move on to the next question. Now what is the answer? Psoas major is the answer over here. Why so? See, let me explain. In this part, when the patient is getting up, right, in the from the supine position without using the hands, let me show you what movement is taking place. So this is the consider, you can consider this position of the, this is the position of the patient in the supine posture. Okay. Now if the patient flexes the hip joint but takes the legs above like this, what is happening? It is the flexion at the hip joint. But this movement is taken place when the muscles of the hip joint are contracting towards the vertebrae part, right? But if they contract downward, then what will happen? The patient will be sitting up from the supine position. In both the situation, this one and the previous one, what is happening is the flexion at the hip joint, and the flexion at the hip joint is done by the flexor, that is iliopsoas. Here you can see this is the iliacus muscle and this is the psoas major muscle. This iliopsoas muscle is crossing this joint from the anterior aspect. It is the chief flexor of the joint. Okay, so that is why psoas major will be the answer to this question. Now let us move on to the next question. Now dear friends, what is the answer? Answer will be biceps femoris. Why? See the common fibular, as I said, wherever the word is fibular, you can interchange with the peroneal. Okay. So here we have adductor magnus. Adductor magnus is supplied by the obturator nerve. It is also supplied by the tibial division of sciatic nerve, right? Semitendinosus and semimembranosus, they are supplied by tibial division of sciatic nerve. This will be supplied by inferior gluteal nerve. But bicep femoris is having two heads, long head and short head. The long head is a part of hamstring that will be supplied by tibial division of the sciatic, whereas the short head will be supplied by common peroneal nerve or the common fibular nerve. That's why B will be the answer. Now let us move on to the next question, dear friends. What will be the answer? See here, the injury is taking place at the level of this you see common peroneal nerve, because the neck of the fibula is getting involved. Okay, at that point we have the common peroneal nerve. Common peroneal nerve, it will lead to the foot drop. Actually, the specific answer for the foot drop should be deep peroneal nerve, but common peroneal nerve, definitely it will be also leading to that foot drop along with the loss of eversion. Okay, but the choice A, like plantar flexion, sensation of the sole of the foot, and the paralysis of the triceps surae, that will be done by the tibial nerve. Now let us move on to the next question. Now what is the answer? Like we have answer is first introceae. Why? See, look at the picture given. So we have the plantar aspect of the foot, or you can say the sole area. What is the nerve supply? This is where we have the tibial nerve, and this will be the medial plantar, and the marked area is having the supply from the lateral plantar nerve. These medial and lateral plantar nerve are the branches of the tibial nerve only, whereas this medial strip we have the saphenous nerve, and the lateral strip we have the sural nerve. So these are the nerve supply for the sole of the foot, the cutaneous. But why first introceae is the answer here? So far as the like motor component is concerned, that means the muscles of the sole, we can say by and large almost all muscles are supplied by the lateral plantar nerve, except four muscles which will be supplied by medial plantar nerve. So we can remember these four muscles only which are supplied by medial plantar nerve. What are these? We have the abductor hallucis, flexor digitorum brevis, flexor hallucis brevis, and the first lumbrical. So only these four are supplied by the medial plantar nerve, rest all are supplied by the lateral plantar nerve. So that's why answer was the first introceae, or any other muscle can be the answer. Only four muscles will be supplied by the medial plantar nerve. So this is like you can see the picture, almost everywhere you can see a supply getting by the lateral plantar nerve, right? So thank you so much, everyone. I hope you enjoyed the session. So keep on enjoying, keep on learning, keep on working hard. My best wishes. Thank you so much.